After studying the anterior thoracic wall muscles, we will proceed with the back muscles or the posterior thoracic wall muscles. Here again we can see that the broad categories are extrinsic and intrinsic muscles, like that in the anterior thoracic wall, but the basis of classification is different, because in the anterior thoracic wall, extrinsic were called intrinsic because their point of insertion was not confined or limited to the axial skeletal system. It was in the peripheral skeletal system, like that in scapula, in humerus, and in the clavicle. And intrinsic were limited, the point of insertion was limited to the axial skeletal system. But here these categories are not based upon the point of insertion. These categories are based on the embryological derivation. Now, extrinsic muscles. Extrinsic muscles are further classified into the superficial layer and middle layer. Superficial layer and middle layer consist of big muscles. Superficial layer has 5 muscles. Trapezius, which is the diamond shaped muscle, really big, and the superior posterior thoracic wall, latissimus dorsi in the lower thoracic wall, and then we have rhomboid major, rhomboid minor, and then the levator scapulae. After that we have the middle layer, which consists of the serratus posteriors. Now, if we see the trapezius, latissimus, rhomboids, and levators, they are all associated with the scapula, because the superficial layer of the back is associated with the movement of the shoulder blade. Whereas the deeper you go, the function also changes. Like in intermediate layer, they are associated with the movement of the thoracic cage, because the serratus posteriors are attached to the rib cage, helping in the movement of ribs. Now, serratus posterior is mentioned here, so we must revise where serratus anterior was. And serratus anterior muscle was a big muscle in the anterior thoracic wall, which started out in the rib 1 all the way to the rib 9, and then it terminated into the medial anterior surface of the scapula. Here we have intrinsic muscle, the deep layer, which is further divided into the superficial, middle, and deep muscles. Now, since they are embryologically different, things which are particular to the deep muscle or the intrinsic layer is that they are innervated by the posterior rami, unlike that of the middle layer, intermediate layer, which is innervated by the anterior rami of the spinal nerves. And then they are associated functionally, they are associated with the stabilization and the movement of your vertebral column. Deep layer consists of superficial layer, middle layer, and deep muscles, and each of these layer has further classification of muscles. Here, superficial layer, we have splenius muscles, the capitis, and cervicis. Obviously they will be associated with the upper region of the back. And then we have the middle layer. The middle layer consists of 3 columns of muscles, and they are oriented from the lateral to medial arrangement. The medial one is called spinalis, intermediate column is called longissimus, and lateral column is called iliocostalis. The difference here is that the point of origin is same for the entire middle layer. All muscles within the middle layer originate from the common tendinous origin, which consists of the tendons arising from the sacrum, lumbar region, and lower thoracic vertebra. But the point of insertion determines their name. They are classified based on the point of insertions, and that is why they are classified in the columns according to their point of insertions. Then we have deep muscles. Deep muscles are broadly classified into the transversus spinalis muscle and segmental muscles. We will cover the deep muscles in separate video since they will require more time, but in this video we will proceed with the superficial layer and intermediate layer. Since we mentioned the superficial layer has 5 big muscles, first one is trapezius. Trapezius muscle is a diamond shaped muscle. Here we have a diagram, again a poorly drawn diagram. So this diamond shaped muscle is called trapezius, the red one. It starts from the medial 1/3 of the clavicle and the base of the skull, ligamentum nuchae. Ligamentum nuchae is basically ligament or that joins the spinous processes of the cervical region all the way down to the T12, and then from there each fiber terminate into the lateral clavicle and acromion of the scapula, acromion and the spine of the scapula. Again they start from the base of the skull, ligamentum nuchae, which is the ligament that joins the spinous processes of the cervical vertebrae, and extending all the way to the T12, and then their point of insertion is in the lateral clavicle and acromion and spine of the scapula. It is innervated by the accessory nerve, which is the 12th cranial nerve, and its motor innervation is by the accessory nerve. and its proprioception, which is the sensory aspect, is by C3 and C4. Now, depending upon the fibers which are being employed, its function can vary. If the superior fibers are employed, then obviously it will help to pull the scapula up. If medial fibers or the middle fibers are employed, then it will help to retract the scapula towards itself. And if inferior fibers are employed, then obviously it will bring down the scapula, or it will do the adduction. Now, starting the latissimus dorsi. Latissimus dorsi is the inverted triangular muscle. It starts from T6 and it goes down all the way to the sacrum. We can see that it is joined to the sacrum, and then it also covers, or it is attached to the lower third ribs. Important thing about that is that it ends on humerus. Trapezius ended on scapula. Latissimus dorsi, inferior it is, but it terminates on the humerus, intertuberculous sulcus of the humerus. It is supplied by the thoracodorsal nerve. Simple way to understand or remember is that it is latissimus dorsi, so obviously it will be innervated by the dorsal thoracodorsal nerve. Now, the three other muscles. We have rhomboids and levator scapulae. Starting with the levator scapulae, according to the name, we can see that it helps in the elevation of the scapula. Here it is, this is the scapula, this region is the scapula, so you can see it's not very nicely drawn, but I hope it helps you. Levator scapulae joins the transverse processes of C1 to C4 of the cervical region. Transverse processes, yani the lateral processes, transverse processes of C1 to C4 to the medial border of the scapula. So obviously their retraction, their contraction will retract or elevate the scapula upward. Now we have rhomboids. Rhomboids, we have two sets of rhomboids, minor and major. We have minor superiorly and major inferiorly. Minor is only two bands, is basically just a small band of muscle which starts from C7 and ends at T1, and again it joins the medial aspect of the scapula and it will do the retraction. Rhomboids are big ones. Rhomboids starts from T2 all the way down to T5, and then again they end at the medial surface of the scapula. They both rhomboids are supplied by the dorsal scapular nerve. These were the superficial layer of the extrinsic muscles: trapezius, latissimus dorsi, rhomboids, and levator scapulae. Trapezius innervated by the accessory nerve, latissimus dorsi by the thoracodorsal nerve, rhomboids by the dorsal scapular nerve, and levator scapularis by the dorsal scapular nerve. Now coming to the middle layer. The middle layer consists of serratus posterior, superior and inferior, and obviously superior will be superior, it will be up in the vertebral column, and inferior will be lower. The point to understand is that the middle layer was concerned with the movement of the thoracic cage, so obviously these muscles will be attached to the ribs. So serratus posterior superior starts from the ligamentum nuchae. We remember ligamentum nuchae, which was connecting the spinous processes of the cervical region, and it goes down to the T3, thoracic third, and then attaches to the ribs, 2 to 5 ribs. So it is very easy to understand that if this is our vertebral column and this is our muscle, it attaches to the 2 to 5 ribs. Their contraction will elevate the ribs, whereas inferior serratus posterior inferior pulls the ribs downwards, they depress the ribs. So in the name we can also see, or we can use the name to memorize their function, that serratus posterior are used to elevate the ribs and inferior are used to pull the ribs downwards, because serratus posteriors are attached from the T11 to L3 in the lumbar region, the spinous processes of the lumbar region, and they are attached superior-laterally to the 9 to 12 ribs. So they depress the ribs downwards. So their function is not similar. One is used to elevate the ribs and the other are used to depress the ribs, but they are used in the movement of the thoracic cage. That is all. This is serratus posterior. They are drawing the ribs downward. Over here, if this is T11 and this is L3, and these are 9 to 12 ribs, so they are moving the ribs, they are pulling the ribs downwards. This is it. So superficially we have trapezius attached to the scapula, innervated by this accessory nerve. Then we have latissimus dorsi, the inverted triangle attaching all the way to sacrum, from the last third ribs, and it is inserted in humerus, intertubercular sulcus of humerus, innervated by the thoracodorsal nerve. Then we have the levator scapulae attached from the base of the skull all the way to the cervical region, and then attaches to the medial aspect of the scapula. And then we have rhomboids. Rhomboid minor is situated superiorly in the in the C7 to T1, and then we have rhomboids major, which starts from T2 to T5, and then they both end in the medial aspect of the scapula, innervated by the dorsal scapular nerve. And then we have the middle layer, which are concerned with the movement of the thoracic cage. Movement of thoracic cage, it means that they are connected to the ribs, and both of them have different functions. One is used to pull the ribs upward, or they are used in elevation of the ribs, and the other set is used to depress the ribs. It is mentioned in their name. If they are superior, then obviously they will pull the ribs, pull the ribs upward, and if they are inferior, then they will pull the ribs downwards. So situated between superior ones are situated from the C7 to T3, starting from the cervical ligamentum nuchae all the way down to the T3, middle of thoracic vertebra, and then they are attached to 2 to 5 ribs. And inferior is in the lumbar region, T11 to L3, and then they are attached to the 9 to 12 ribs. Opposite function. That is all. Thank you.